diagnosed with gastric MALT lymphoma, but what does that mean? Gastric MALT lymphoma is a cancer of the stomach lining, more specifically, cancer of the most superficial layer of the stomach lining called the mucosa. MALT stands for mucosa-assisted lymphoid tissue, which is basically just collections of immune cells called B and T cells in the mucosa of the stomach. This cancer is rare, slow-growing, and usually affects people over 50. Men are 2 to 3 times more likely than women to be diagnosed. There is a strong link between gastric MALT lymphoma and infection by Helicobacter pylori bacteria in the stomach. The stomach lining, or mucosa, does not normally have lymphoid tissue, or MALT, but when H. pylori bacteria colonizes the stomach, they trigger the recruitment of immune cells to the stomach mucosa, which leads to the growth of MALT. Although it is very rare, these newly recruited immune cells in the stomach can undergo cellular changes and develop into gastric MALT lymphoma. Genetics may also be at play in this cancer because 10% of people diagnosed don't have H. pylori infection. Symptoms of gastric MALT lymphoma can include nausea, vomiting, stomach pain, and weight loss, though often the only symptom is persistent indigestion. Some people will experience no symptoms at all, and gastric MALT lymphoma is detected during other tests. During an endoscopy, signs of gastric MALT lymphoma include erosion of the stomach lining and shallow ulcers, enlarged rugae or stomach folds, and thickening of the stomach lining. Some people with gastric MALT lymphoma, however, will have normal-looking stomach lining. Because of this, gastric MALT lymphoma is diagnosed by taking a biopsy or a sample of the stomach lining to look at the cells under a microscope for changes consistent with cancer. An H. pylori breath test is also done to check for infection. In 70 to 90% of people, gastric MALT lymphoma is successfully treated by simply eradicating H. pylori from the stomach by taking a combination of a drug called a proton pump inhibitor and 2 to 3 different antibiotics for 7 to 14 days. We don't know why yet, but even when people have gastric MALT lymphoma without H. pylori infection, their lymphoma can still be successfully treated by taking the medication to eradicate H. pylori. It can take months to years for the lymphoma to disappear, and some patients may need additional treatments, including chemotherapy, immunotherapy, radiation therapy, or surgery. After successful treatment of gastric MALT lymphoma, continued management is important because this type of cancer often returns multiple times and very, very rarely can transform to a more aggressive type of lymphoma. Around 3 to 6 months after H. pylori has been eradicated, an endoscopy and multiple biopsies should be repeated to check that your lymphoma has begun to disappear. Biopsies should then be repeated every 6 months for 2 years, and then yearly after that point to ensure that you remain in remission. The prognosis of gastric MALT lymphoma is very good, with 5-year mean survival rates of 90%.